Tracy, good to see you.
Nice seeing you.
All right, looks like you got some low back stuff going on. Oh, I see that Angela referred you. That's awesome. We'll have to thank her for, putting her faith and trust in us enough to send you here. Before we get started, do you mind if I go over a little bit about what chiropractic really is?
Nope, not at all.
Okay, come on this way. Okay. Do you know which organ controls all healing and functions in the body?
Is it the spine?
Close. The brain.
Oh.
So what the brain does is it sends signals down your spinal cord out through these nerves so that these organs can function. So in order for your heart to beat, your lungs to breathe, or to even heal a cut on your body, you need to be getting these signals from your brain. Does that make sense?
Yes.
Okay. Well, what happens is that, sometimes with the way people's posture is and life, it can put your spine out of alignment. We call this a subluxation. Okay, so can I borrow your arm for a second?
Sure.
So what happens, your spine is given the all-important job of protecting these nerves here, your lifeline, but when it's out of alignment, it puts pressure on these nerves. So what do you think is happening to this nerve over here?
It's not receiving any signals?
Right, it's going to decrease the function. So what's going to happen to these organs over here?
They're not going to work as well?
Exactly. So do you think that an aspirin or any sort of painkiller is going to take care of this problem?
No.
No. So what do you think we have to do to get rid of that problem?
Remove the interference?
Right, you want to get the pressure up. So then we go in as chiropractors, we do your adjustment, takes the pressure off of that nerve so that these organs can function. Does that make sense?
Yes.
Awesome. So now it's really important that your spine is in alignment, not only to get you out of pain. I understand that you're in pain and it's obviously a goal to help alleviate that symptom, but beyond that, when your spine's out of alignment, it's forming these cells that are sick and causing disease in your organs. So that's a huge deal. That's really the most important part. And even if you're not experiencing any symptoms of those organs forming disease, your body can actually function up to 60% before you start showing those symptoms. So would you agree that there's a state in between the subluxation and the symptom stage?
Yes.
Right, so we call that dis-ease, and that's what we're really concerned about. So with your adjustments, we can get your spine back in alignment, take pressure off those nerves, and form nice healthy cells. So come on over here, we'll get started with your exam.
Okay.
Okay. So you can have a seat here and face the chart.
Okay.
Okay, so I see that you have a lot of forward head posture. So if you look at this chart here, when your head is forward, it's going to add about 12 pounds of pressure to your spine and nervous system. These are going to contribute to things like your headaches, the numbness and tingling in your arms, things like that. Okay?
Okay.
So I'm just going to do some quick palpation here. Oh, you see how this part's nice and squishy? And this part kind of feels like it's not wanting to move at all?
Yes.
So this is what we search for as chiropractors. That's where you're subluxated. This joint is not moving properly. So right up here at the top of your spine, these are going to go for things like your headaches and dizziness and tiredness, things like that. Oh, see this part is really stiff too. Do you feel that here?
Yes.
Okay, so long term, this can lead to throat conditions, asthma, things like that. Okay, so you got a lot of tightness going on in here too, both sides. And right here, this is also key in breathing, asthma, things like that. I know that you have asthma, so that's going to be an area that we're going to want to focus on for the treatment here. Okay, so down here, this is also pretty stiff down in here. This is going to contribute to digestive things.
Okay.
Okay, so Tracy, based on your exam findings here, you got a lot of forward head posture, there's a lot of stiffness in the back which you felt. So what I'm going to do today, I'm going to recommend that we get x-rays so that I can be sure kind of the level of subluxation. I could just feel around and kind of guess, but there's no way for me to tell the difference between this and this without an x-ray. Does that make sense?
Yes.
Okay, so we're going to do x-rays today, and I'm going to go over them thoroughly, and then on your next appointment, I'll go over those x-rays with you, and we can start with a plan of action, okay?
Okay.
All right.